75 countries on Friday called for global solidarity for vaccine equity at the general debate of the Third Committee of the UN General Assembly. The countries issued a joint statement, which was read out by Zhang Jun, China's permanent representative to the United Nations at the debate.
The pandemic knows no borders. The only solution lies in global solidarity, unity, and multilateral cooperation. We call on all states and stakeholders to strengthen solidarity and international cooperation to contain, mitigate, and overcome the pandemic and its consequences, ensure protection for those most affected, including women, children, youth, the older persons, and persons with disabilities, and take measures to counter misinformation, disinformation, stigmatization, racism, and xenophobia. At this critical time, it's crucial to step up our joint efforts to leave no one behind. We recognize the need to begin treating the COVID-19 vaccine as a global public good and for health. We commend the contributions made by relevant countries and platforms such as ACT, Accelerator, and its vaccine pillar, the COVAX facility for promoting vaccine accessibility and affordability through bilateral and multilateral channels. However, vaccine equity is still far from being reached. The progress on vaccine rollout has been widely uneven and unfair. Many countries, in particular the developing world, still lack adequate access to available and affordable vaccines. We are also worried by a disturbing trend of vaccine nationalism and the stockpiling of vaccine doses beyond need. In that regard, we welcome the WHO's call to prioritize vaccinating the people most at risk around the world who are yet to receive their first dose. We support the Secretary General's call for vaccine equity in order to ensure no country is left behind. We call upon all states and the relevant stakeholders to step up coordinated and concerted efforts for fair and equitable distributions of vaccines in developing countries, including in the LDCs, LLDCs, and Cs, low and middle income countries, to ensure that the population in the developing countries enjoy the right to life and the right to health. We call on capable vaccine-producing countries to translate their commitment into actions and ensure timely and adequate delivery of vaccine support to receiving countries. We call on all states and all stakeholders to strengthen global solidarity and jointly promote fair, affordable, equitable, timely, and universal distribution and strengthen local production of vaccines around the world.